And we are back in action. Okay, I see the next startup is already ready to rumble. Jury members, are you ready?
Yes.
Ready.
Marguerita, are you ready? Perfect. So let's have Arete Med Tech start.
Thank you. I'm Graham Douglas. I founded Arete after my PhD at Cambridge in bioengineering, inspired by my own struggles with asthma. Also on my team is a great collection of people in product development, engineers, software developers, business development people, people who know medical devices really well, and clinical partners. I started Arete, and in the early stages was very fortunate to connect with some of the smartest minds in the world in precision respiratory medicine. And from the very beginning, we've been very need-driven in building a product that is most likely building on the science, most likely to be giving benefit to people with asthma and COPD. Asthma and chronic obstructive pulmonary disease, or COPD, are hard, massive, and under-addressed problems. They're the third leading cause of death. They affect about 1/10 of people around the world, and they result in huge direct costs, nearly 100 billion each year in the United States, and a similar amount in Europe scaled to number of people. Most of these costs come from people with severe and unstable conditions, and are largely driven by hospital stays and drugs, which can be extremely expensive in the United States as well as in Europe. In response to this, we're developing the Respicorder. The Respicorder is a handheld device that would sit on a patient's bedside table, and each morning they breathe into it for a few minutes, which gives them a complete picture of their lungs in the lung mechanics, inflammation, and resistance to airflow. We've built a second stage of the prototype, which is moving into development now. It'll be the product that we move to market, as well as a companion app, which lets us bring in different types of data that can be really important in managing these conditions, like weather data, pollutions, allergens, and giving access to the patient record. Importantly, while the person with these conditions has to be in the driver's seat to manage their disease from day to day, there also needs to be really good involvement and really good access to the data from clinicians, be it doctors, nurses, to be able to change prescriptions and intervene earlier when people get ill. What we're looking to do is give a whole picture of the lung function and inflammation by providing daily self-management from specialist trusted measurements and giving the information that patients and doctors need to avoid attacks, which is the same information that we can use to train algorithms to build patient-specific prediction models to be able to intervene with the right drug or the right behavior change at the right time. We're looking to do for lung conditions, which has been well proven in other chronic diseases, especially diabetes. Respiratory health tech has been in two main silos. First of all, we've got specialist grade equipment, which is in hospitals, but is very expensive. The second is that we've got digital health products like wearables that are really close to the patient, but they're just not powerful enough to be able to make predictions or target drugs when and where they're needed. We think to get the promise in respiratory that has been seen in diabetes and cardiovascular care, we need to be able to bring these high quality measurements that match the disease. So they have to be able to understand the complexity of the lung immune system, but also being close enough to the patient so they can get the measurements in time to intervene early and to be able to target the intervention that's needed for that person's individual type and individual factors that contribute to the disease. Asthma and COPD are really, really personalized. Our revenue model, we're looking to go to hospitals in a B2B2C model, where hospitals then give the device on to the end patient who uses them. Focusing on the US and for COPD, there's over 1 million people who are admitted each year to hospital for COPD, and the costs on average nearly $10,000 per episode with a 7-day length of stay. We think our product can help have a 2-day reduction in length of stay, which means the hospital bed is free for someone else and the hospital costs are reduced while they're getting that same base payment from insurance companies. The hospital can also use our product for remote monitoring afterwards and use that to get revenue and also continue to build the relationship with the patient. So that patient is well known to that doctor and that hospital when they need to come back in, and that patient will go to that hospital rather than another hospital of a competitor of theirs. So our business model will be to have an upfront payment, which goes in existing reimbursement codes tied to the episode of care between $1,200 and $1,500 US per patient per episode, and an ongoing revenue coming from almost subscription-like basis from the monthly remote monitoring, which is also covered by existing reimbursement codes. In total, this is over a $2 billion US addressable market size for COPD only. Asthma makes it a larger overall opportunity, as well as Europe and the rest of the world. Had some great ignition of support from Innovate UK and Horizon 2020 through the Eurostars program. We were ranked second in Europe out of 369 applicants, giving a total of over 2 million euros of funding, mostly non-dilutive, a little bit from friends and family, convertible notes. But we're looking for now seed investment to complement the grant funds that we've already got committed to cover things that the grants can't be applied towards, like the time between regulatory submission and when we get clearance from the FDA and European bodies, to covering the go-to-market commercialization and for international patent rights, and to manufacture the device in a way that's ready for scale-up so we can help the millions of people with these chronic lung conditions worldwide. Thank you very much for your attention, investors and other people who want to help us help the millions of people with these chronic lung conditions. Please do get in touch, and I've got a link to book a meeting with me on Calendly next week, or we can meet in that ring. Thank you.
Great timing. Jury members, Marguerita, want to start?
If you want me to, yes. I mean, you have shown quite some figures about the US market. If you have similar considerations and figures for the European one. So, or if you can comment if you intend firstly to enter in the US market and then maybe come back to the European one. I didn't understand this. Maybe you mentioned it.
Our intention is to go first to the US market, largely because it's one single country and one single reimbursement system. And also well, it's been the opposite in the past. The FDA is now an easier route to market for a product like ours than European regulatory agencies. But the European market size is quite similar. In general, the population in Europe is a bit larger than the United States. The prevalence of these conditions is very similar. But the price of hospital stays is more in the United States compared to in Europe. So we might have to have a slightly lower price in Europe, but it would still be well within a good profit margin.
So I have two questions. Can you hear me? Yes. Okay. The first one would be, you mentioned some competitors around in the market, like Propeller, for example. What makes you sure that your approach is better than the existing on the market? And the second is, how do you plan to go into the market that you mentioned? Like, do you go to hospitals? Is it like salespeople going to hospitals, or what is your strategy on that?
So Propeller is probably the leading respiratory health tech company at the moment. Their market cap when they sold to Resmond was about 200 million US, whereas Livongo in diabetes sold for 20 billion US. So while Propeller is the leader, there's still a huge unsolved empty space in respiratory. And I think the real difference between us and what they're doing is that our bet is that the signals that are used to make the patient decisions are what really matters the most, and that the approach they're taking just isn't strong enough signals. And in terms to go to market, certainly initially, I think we need to work with, and as we already have, key opinion leaders. We've got a collaboration with the University of Amsterdam Medical Center. Initially, I think it will be going directly to hospitals, building traction, building evidence, and then that's what further hospitals are looking to see to come on. So you get the early adopters and then use the evidence from them to then build on to further customers. But there's only, in the United States, there's about 400 or 500 hospitals that would meet our main category. So there's not that many customers to target that going direct to them would be quite viable.
What's interesting though, because you mentioned diabetes quite a few times, but one of the key things I think is back to the point you just made. It's taken a long time for diabetes to actually become that area where people now recognize that this type of, use of technology is able to support it. What is the timeline before you see this being recognized as a potential proper solution to be adopted within the marketplace?
So a great position we have is that because we're doing measurements that have been around for a long time, they have been used in research for a long time as well.
Right.
Really, the new part for us is making it economical to bring those really quality measurements to where they're known to work well in research. I think in terms of our timelines, we're looking to get through regulatory clearance early 2022. We've already got clinical partners we're working with leading up to that, and people who are interested afterwards as well. And I think IB's model about what worked, what didn't work, so that instead of following the wandering roadmap that they had to take to get to the scale that they have now, we can cut the corners where we can to follow the best practices that they've provided.
Because
I think it's a medical product. It's not going to be solved overnight either, but I'm highly motivated, being an asthmatic myself, that if it takes 20 years to build a huge company, it's well worth it.
And with the son that's asthmatic as well, I'm very interested to hear obviously what you're doing. But sorry, if there's just time, Valentine, it's the adoption piece that I'm really interested. The biggest challenge we see in medtech generally is actually getting the users to use the technology at the end. So and you even mentioned they'll take a few minutes in the morning to use. Do you have any sort of feedback around adoption or usage rates, or is it too early to tell?
Well, I think it is a huge part, and it's something we spend a lot of time thinking about and talking to users straight up. We have an advantage that I know quite well. I tend to be a fairly lazy person with that sort of thing. So if it's good enough for me, it'll be good enough for a lot of people. But I think people do make it a subconscious trade-off that they're willing to invest the time if they're getting the time and the value back. Where people use things, it's because they're not seeing that they're getting the value from it. So a lot of things that people don't use in health products is often because they're not really solving an immediate problem for them.
Absolutely.
Thank you very much. Andrew, I'll ask my team to do a one-on-one to make sure you can continue the topic. Okay? Thank you very much, Ram. Moving on to Sensegrass. Lalit, you got the floor. Please share your screen.
Thanks. Just give me a second.
Great.
I'll set up my screen. Can you see my screen, right?
Yes, but please share your presentation.
Awesome, great. Just logistic chat screen on full, and the slides are changing as well, right?
Yeah, right now. Yeah. Start. Thank you.
Okay, awesome, great. So good evening, everyone. This is Lalit Gautam. I'm the co-founder and CEO of Sensegrass. We are making the tools for the future of farming. According to United Nations, one of the key problems in our agriculture or the food value chain is using excessive chemical fertilizer. So the food we consume every day, it has around 65% of excessive nitrogen in the fertilizer, because our farmers or our companies, those who do the food production, have no idea what's happening under the soil, and lack of the real-time soil information and what's happening under the soil, that leads to the use of excessive chemical fertilizer. Unfortunately, the only conventional method or companies and farmers have to do the test or the nutrition diagnostic is a traditional lab method. No matter if you are in Europe or Asia or US, this is the only method. Take the soil sample, do the chemical test, up in a few days or up to a week, they get the report card. Highly traditional, small unit ratio, less accurate, highly expensive. And at the end, they only get the data card. So data without solution, again, a problem for them. And to solve this problem, Sensegrass brings the soil intelligence platform with a combination of a patented IoT device and an AI agronomist to make farming sustainable, but also environment safe. In the next few slides, I'm going to explain the main solution of Sensegrass. That's the mix of two components. The first is a Npk Sensor. That's a plug-and-play device that goes into the field and measure around 14 parameters. The value proposition comes from the nitrogen, phosphorus, potassium. That's why I call it Npk Sensor. That's the patented part. It comes from the 3 dApps, and it's a very smart technology, highest number of parameters from a single device. So it simply work on the cellular network, send your microsoil data, nutrition data, or in your crop directly to your AI agronomist. So AI agronomist is something, is an analytic platform. In a very simple word, is provide the AI advisory. It's provided different value propositions to the company. You have a high nitrogen 3 blocks east from here. If you reduce by 2%, you will get a crop yield. Our AI agronomist software works on 4 different data sets: sensor data, satellite data, the manual data, and the environmental data. We combine all these data sets in the pre-trained ML model according to the 20 types of crop which we are working currently. As you can see, we provide the different value proposition from fertilizer prediction estimator to crop modeling, plant card, and offer different value proposition in terms of, from farm to fork. So you can evaluate and estimate how much resource you are using in your food, whether they are high or low. So it maintains the right nutrition value in the whole food chain. And as a consumer, we can also aware where the food coming from, what is the nutrition value. So post-COVID, you can imagine that my fruits coming from Peru or maybe Morocco. And what is the nutrition value, whether they are infected or not. So these kind of information as a consumer you can also get. But as a large food and agro producing company, FMCG retail houses, they can also aware, so they can maintain the whole food production. Of course, as I mentioned, we have a different value proposition, but we broadly categorize into three benefits to the user. We reduce the excessive amount of chemical fertilizer and water saving. We improve the crop production, so we help them to grow faster and healthier. And the third one is a very simple one, is a financial benefit, fiscal benefit, so they can improve their income. As I mentioned, this is a 360-degree solution for the multiple use cases. We are B2B, B2C company, primarily work with the food and agro companies, FMCG, retail chain, even governments and non-profit as well, those somehow directly, indirectly involved in the food production. Of course, we are US-based, French-based company, primarily focusing the US and European market. Of course, this is large market, not going deeper into that segment, but currently focus in the European US market with the early adopters. In terms of the competitive advantage, we are definitely an agtech food tech company, but into the Npk detection, the nutrition detection. And there are only 3 companies, including Sensegrass, working right now in that segment. Because of the high entry barrier, that makes us like a more first early advantage for us. So our FTIR optical spectroscopy, the first AI agronomist SaaS platform, the CIS involvement, make us one of the most advantageous and awarded company in that segment. We are 2-year-old company. The first year was more in research and development. The second year we went into the market and we got the great response. We have 100 plus users around Europe and US. These are more enterprises customers. And we got a lot of bookings. And during the COVID, we have seen when the companies were struggling, we have seen significant increase in the terms of bookings and the paid things. So we do have a traction as well. Some of the notable clients which we are working currently, and some of the largest corporation like John Deere, Corteva are already in our sales funnel, as well as they have invested recently in Sensegrass. Our business model is pretty simple. So we have a customized business model that starts from 20 to 25,000 USD onward, completely depend on what is their requirement. While a very simple enterprise model that starts from 3,000 to 5,500, that comes in a package, which involves hardware and a software subscription. So unit cost is $8 per acre for them. Behind every successful startup, there is a strong team, 3 co-founders coming from the farming background back in India. They have lived and worked in different parts of the world. 2 exits in the past in Forbes 30 under 30 team, MIT 35 500 team, and won some of the best awards in that ecosystem. So that make us like not just a high, good, deep tech product, but also have social impact. Thank you so much for your patience and happy to take your questions.
Thank you very much.
Right. What is your distribution strategy again? It sounds like you work through the through the buyers and the PepsiCo, so on the supply through the supply side.
Yeah, so our go-to marketing and the supply strategy is something like, we usually do not go to the farmers, like the end user.
Mm-hmm.
We usually work with the food and agro producing companies or the non-profits and governments, folks, those who usually sell these their product or who do the contract farming with the farmers.
Yeah, okay.
So this is how we work.
Mm-hmm. On both sides. Yeah. Interesting. And your device, is that a unique device from a technology perspective?
Yeah, so Marcel, as I mentioned, like this Npk detection, like the nutrition detection is a very innovative stuff in the agtech segment. So even if you do a very deep Google research, you will find only 3 companies. The Tyrolitic, which is a US-based company, we and Agrocare, which is a Netherlands-based company. Tyrolitic and Sensegrass very closely in terms of the technology and the offering. There's a plug-and-play sensor, while Agrocare is a handheld device here.
Mm-hmm. Yeah.
How much devices do you need per acre? Like, I think I didn't.
Yeah, so the very simple answer, Michelle, for this is like it completely depends on your soil and crop conditions. So let's say if you have a high cash crop, vegetable crop, right? you can go for like one device up to 10 to 15 acre. If you have a raw crop like soybean and corn, it will go up. But I think one more thing to add is like it's also depend on the customer choices. So hey, you saying like one sensor can go 10 acre, but I want my production good and better, I can put 3 devices, 5 devices, something like that.
I'm intrigued.
You keep it in term.
Whether there was any,
Sorry,
were there any particular crops that you find this is extra beneficial for? Like, forgive me, I don't know my NPK across different crops. Is there ones that you find this particularly beneficial for?
Yeah, so we work with the 20 crops, Andrew, but like, we have a very specialized, so we have a, like, we are not crop agnostic. So we currently working with the 20 crops, and for each crops, our AI model, we have divided into the different microservices, right, like crop specific, soil specific, location specific, climate specific. Okay. So this is how we offer. Yeah.
That's great. Thank you.
Yeah, cool.
Great.
Right, if I may, no. Sorry. From my knowledge, and this is not extreme, but agriculture is one of the less digitalized sectors. Have you encountered any difficulties in letting farmers actually implement and use your solution?
Very important question, Marguerita. So quickly, add this. So it's a blessing in disguise, right? So agriculture is the largest industry in the world. There's no recession, food will always remain there, but it's a very labor intensive as well. And again, whether it's a US, Europe, or anywhere in the world. And because of the COVID, we got, as I mentioned, blast in disguise, we got a lot of response. So nowadays, people have realized how important is the digitalization of the farming and agriculture food chain. The first is from business side, and the second is from the safety and the healthness side. So 65% of excessive fertilizer remain in the field, you can imagine. So now people are, especially in Europe, the policy-wise, it's not just the business and technology-wise, even policies-wise, Europe is one of the most sustainable nation in terms of farming, agriculture practices. So all these points come together and make this industry and this segment very useful to work in.
Okay.
Thank you very much. Unfortunately,
thank you so much, Valentin. Thanks, everyone. Stay safe, guys. Bye.
We do appreciate the interest. Let's move on to Heuristik. You're going to love this guy.
So, as I was saying before, the 54% of patient identification errors inside hospitals are caused because of identification bracelets. This is because the printing issues, they wear off with the use, some of the patients refuse to use them, and of course they swap them. So basically the nurses can provide the wrong bracelet to the patient. A normal hospital usually prints around 1,000 bracelets per day with a cost of almost €1 per each. So with these statistics, we can see that the identification bracelets are not accurate enough, they are so expensive, and they are not environmentally friendly. Actually, they only have one use, then they throw it away. So we have developed the fastest, safest, and most accurate to identify patients, biometrics. We are also working with ambulance companies to identify unconscious or undocumented patients. This is one of our pilots with DIA, which is one of the largest in Spain. Making the pilot, they like it, the solutions that they even invested in our company. We have a really competitive team with senior software developers with 30 years of experience, PhD. We also have key mentors in the key areas like healthcare to penetrate the market, health technology evaluation. We have 2 signed pilots for next year with one of the largest public hospitals in Spain. We also have pending pilots in Portugal, Spain, and Germany. We've been part of one of the most biggest acceleration programs in Europe in the healthcare area, also in the non-healthcare. We have key international partners. We want to raise 250,000 euros to expand in some of the pilots that we already have. And our roadmap is basically that from 2021 to 2022, we will be making pilots in some of the selected countries in Europe. Then in 2023, we are working with one of the largest acceleration programs in the United States, and they want to help us raise a Series A investment there and also put in contact with home hospitals.
Thank you very
And
much,
in 3
Anton.
years, we see ourselves as the leading healthcare biometric company in Europe and starting the expansion to the US. And that's all. Thanks.
Thank you very much, Anton. We will make
Yeah, no
sure
worries.
to connect you, Adam and Rob will make sure to connect everyone with investors. And we move on to our last startup, which is SDX Network. Let me know when you can see your screen.
One second.
I'll give you
Okay,
3.
now good.
All good, please start.
Can you guys hear me?
Yes,
Yep.
everything's fine. Please start.
Okay. My name is Alex. I'm CEO and co-founder of SDX Network. So, you know, like 10 years ago, I've been working as B2B neobank in Russia. And it's the first time when we started, you know, to apply analytics on top of third parties' data in order to understand better our clients. And I realized how complicated it is to access, you know, third parties' private data. Then 10 years after, I started my, let's say, entrepreneurship career, I launched several companies. I did my MBA, current founders, these great people, and we realized that the problem is the same. But at the same time, we see that big data market is growing rapidly. Companies are investing like crazy in analytics. We also see that almost all of the corporate decisions are expected to be data-driven, but still, like today, less of 1% of data is still available for analysis. And mostly this is because not only the general ownership protection, which I faced like 10 years ago, but also growing regulations and that complicated processes of, you know, like reaching an agreement, how to handle, where to move, like the private data to make the analysis being secure. And we have come up with a solution for this, which is SDX Network. It's a compute-to-data platform, allowing data consumers to perform secure analysis on top of third parties' data without moving the data from its initial premise. We're developing different components within our platform, which basically allow to execute any type of computation on top of any type of data with a quite easy setup. SDX can work as a web platform, but also can be integrated into existing solutions, like in the kind of second level. And the key differentiation, key technology, which we're mostly working in the first version of our product, is the proprietary federated learning protocol, which we have developed, which basically allows to do the following. We have a data consumer, which either have their own algorithm or they might be hiring AI as a service company. We have one or multiple private databases. Encrypted, because also we need to protect the intellectual property of it. It travels to those multiple private databases, executes the computation directly in the premise where the data is, and then comes back the results of aggregated, weighted aggregated results directly to the data consumer. So right now, first of all, as I mentioned, we're really like agnostic to type of data and type of algorithms. Right now, we're working on 3 proof of concepts. One of them is our first paid client in the financial sector. It's basically a trade finance platform, which is now doing credit scoring for the banks. There are many banks using it, aggregating information in real time from multiple private data sources, for example, financial accounts. Another one, of course, is healthcare. Basically, AI as a service company, which needs to help companies like pharmacies, you know, to securely access healthcare patients' data. And the third is market intelligence and retail. So this is our go-to-market strategy. So we're doing now, focusing on integrations with partners like AI as a service companies, working with private data, like I mentioned. Also, of course, we start working with tech consultants or help clients, you know, understand how to handle, and platforms like this trade finance platform, which are, you know, also somehow working with private data. But in the end, all of the end users are paying transaction fee to SDX, our key business model. So this is a bit of like technical slide of our comparison solution to our protocol. Which we have is that we have much lower computation complexity compared, for example, to homomorphic encryption or to other federated learning protocols, which means that we are more scalable and require less computation power. So this is our team. I have told you a little bit about myself. Andy, our CTO, is the one of the leading global experts in cryptography. He's been working for A-Star, Singapore AG in the last 10 years, leading the development of many projects in this area, and he's the one who designed the algorithm. Tony is our head of BizDev, been selling all his life and for the last year in the big data sector. And Alex is the expert in integrations because he's a tech consultant and did, like very complicated projects enterprise level. And we have the team of brilliant guys, like mostly first-hand developers, product managers from Ukraine, which we are now paying contract based, but they're ready to get hired once we raise the funds. So during this year, we have set up the team, we have done our first MVP. Now we're analyzing the first proof of concept, which will allow to execute this federated learning computation for the trade finance platform. In the coming years, we're going to focus on, first of all, developing the first version of the platform itself, which is more manageable with kind of, features, more sellable, more scalable, then add more features. And of course, the goal is to bring more sales. So right now we're raising 700K, which will basically allow us to hire the technical team and execute the first version of the platform, bring more sales. And this is also what our, potential partners are now requiring us. And and basically, of course, have a little bit of runway till the next round. And why we think we are a very unique, team to invest, because first we have really a good combination of knowledge on business. Timing is perfect because the solution, like our technology, recently been, and also we see a high demand for this kind of, market. Thank you so much.
Excellent timing, Alexander. I do respect that you respected the timing.
Yeah, pleasure.
We will respect the 4 minutes, even if it's the last one. Go ahead.
I have a question, Alexander. Thank you. First of all, thank you for the presentation. Can you name us a practical example of the use of your product? I might have missed that, but this would be made more tangible because it's a very technical topic, of course.
Okay, sure. So I'll give you a couple of slides. For example, this one, very simple. You see it, right? The healthcare now. So first of all, there is a pharma company which are buying data, like for example, healthcare records. And the problem is faces, imagine they go to a hospital, and hospitals and they have their data is highly regulated. I mean, it's regulated in the way that for a hospital data here in Spain, it's not that you're fined. And sensitive thing. And hospitals are very, concerned about moving data somewhere. Somebody comes and say, okay, give us your data to analyze. For example, here is the pure case because MMG, they have this AI as a service company. They have very good algorithms for doing this. And basically now with our solution, hospitals are more excited because they say, okay, good. So basically we're selling you the results of the computation, but you don't touch our data. We don't have a risk of losing the data. And the second very briefly used case is I told you about the trade finance platform. So here the thing is that this platform is to manage import-export operations, and banks are using it to basically issue financial products like letter of credit, for example. So importers, exporters, they upload documentation on this platform and bank use it as a source of basically trust. And then, that nowadays companies, they used to have accounts in multiple banks. So now this trade finance platform are developed, which is like a scoring algorithm, aggregates data from multiple bank accounts of a clients, plus, historical data of the import-export operations. So not financial data, but how was the transportation, how didn't guy have any problems, any, things with customs, etc., etc. And banks are excited to share the data and also to use this kind of service. And without a solution, it couldn't. Basically nowadays, in order to analyze private data, to apply algorithm on top of it, you need to say, okay, guys, give me your data, let's anonymize it or encrypt it, move it to some, third-party trusted environment, and it's not real time, so it already loses its value. Does it make sense, or should they give you more cases?
It makes sense now. Thank you.
Okay, my pleasure.
I'm not sure if I have lost it, but which is your pricing strategy?
It's a transaction fee. I have it over here. No, very quickly. So basically, you still have
the amount.
Sorry?
The amount.
It's really it depends on basically on the either on the price of the data set if somebody is purchasing a data set, but basically it depends on the volume of data set and volume of operation. But we're very honest, because this is what we are, while we're talking now to VCs, because we're now in active conversation with several deep tech European VCs, we say that basically pricing strategy is one of the things which we expect a lot, because this is the one thing that we need strategic help from our investors, because there is no place, where we can look and for alternatives like this. What we can do, we can only evaluate what, for example, how much time we're serving to clients, or how much money, they don't need to spend on anonymizing the data, etc. So, but still, the numbers still need to be defined more accurately, to be super fair with you.
If there's time for one more, just one of the questions I've got, Alexander, and thanks again, is what makes you the trusted partner in all of this? Because obviously being a small company, and you're talking about the most sensitive detail or information data that companies have, why would these companies trust you?
No, I can share you our experience, like with real client, for example, this like with the healthcare or with the trade finance platform. So how it happens in reality. So first of all, you present it and they say all the same doubts you're saying right now. So what we do, we said, okay, guys, look, let's do a very simple thing. Let's do just a testing. So we say, okay, give us, like, I don't know, some simple data sets, put them in 2 different places and algorithm in the other one. And we give you our solution just to try, one free operation. And you check it and you see, you try different things. You basically try to send the cheat code to steal the data. So we said, try different manipulations. And then only after, for this, they agree very easily, because they can give you like some fake test data to try and things like this. But of course, it's not very scalable approach right now, because you need to educate clients, you see. But again, an innovative thing. So basically, of course, now once we have more traction, and I don't know, imagine we go to like finance, because now, for example, this trade finance platform, they're part of one of the largest banking groups in Spain, which is also very big internationally. And then our next, tier level of partners start seeing big logo, and they will say, okay, if these guys are using it, probably they're not stupid. But on our platform, we will allow this, like demo thing and trying things for free. It's not a problem. So at least now it helps, and people say, okay, if we see it work, then the trust issue is kind of like solved.
Great, thank you, Alexander.
Thank you very much, Alexander. And that concludes our pitches today. Thank you everyone for your time. Thank you, Alexander. Thank you everyone for your time. Every startup founder, extraordinary work, great job. Now we will go to another room. Jury members, please meet me in the jury member where we will deliberate. And for the startups, they are gonna wait for us to come back with the results. Please have a coffee or a tea, whatever you want. See you here. And we are back. We are back. Who's with us in the chat? Let's see. Are the startups still here with us?
You'd hope so, really, wouldn't you? It's like they've given up. They've given up.
Give me something. Or I'll give you this again.
Yeah, we should tell them
that sound.
Yeah, exactly. You're going to be dreaming it, Marguerite.
Find another one.
Well, you're gonna remember me, and you're gonna remember the sound of me, actually. Okay. First of all, okay, the startups are with us. I want to see more yeses on the chat to know that everyone is listening. Meanwhile, we're gonna provide some feedback, because I know the jury members have a lot to give back. So who wants to provide some feedback for the startups so far? Marguerita, please do it, because gender balance and everything, I try to push it tonight. We didn't have a lot of, non-female presenters, so please help us here.
Okay, so first of all, thank you everybody. It has been a really interesting occasion. I hope to be working with some of you in future projects. In some cases, I see quite some room still for experimentation. So I think that the next framework program, like Horizon Europe, can be a support for some of you to develop further some use cases and concepts. In general, I've seen some optimism respect to the current digital infrastructure of some sectors, and this is a pity because the solutions are really great, but probably the sectors that are addressed are not as ready as some of you consider. These, in general, as a feedback. Of course, the time was limited, but I would have asked a lot of questions more. Do you expect me to go punctually for each solution, or general feedback?
I think general feedback is okay.
Okay, so I think I've done it. And congratulations to everybody for participating and for sharing with us your ideas, and also for all the work that you have already done so far, because all of you have already showed us that you have participated in contests, in prizes, in previous projects, and I know that this is a very long journey and requires commitment, patience, and capability to resist to very strong time. Another small feedback is that I've seen in some of the presentation that you might not, that I had the impression that you have not considered the disruption in the sectors that have been caused by COVID-19. This example, but when we were discussing the CAN case, so the CAN IoT, the first thought I had was the event sector is going to be disrupted for at least a couple of years, and CAN are those kind of beer format that goes typically in events, and maybe I was not super sure that the disruption to the event sector has been considered in the evaluation, but this was just a risk that I have seen. I have not accounted it in the evaluation. It was just a concern that I had.
Very good remark, Marguerita. Thank you very, very much for being here and for the feedback. Who else wants to add some value?
Yeah, I can share my observation. So, I mean, as an investor, I think it was a really nice mix of companies. Stage-wise, some companies raising pre-seed, others bigger rounds. Sector-wise, the industrial sector, health tech, sustainability solutions. I think that was really interesting. Some very applied solutions, others more foundational technologies. But I thought that was a good maybe that's more of a compliment to the organization, but that was a really nice diverse mix of companies to look at, and it didn't make the decision very easy.
Okay, great.
Did Michael want to add anything?
There's been said many things. Just one addition, when I saw the pitch slides, if you have a very technical topic, just try to make it as tangible as possible with the use cases that people that are not in the industry or not in tech necessarily can make up their minds about the use cases. But this is just a small impression. I think all the presentations were very nice displayed in general. So keep it up. I wish you the best of luck for everything for the next pitches. I know there are many. So thank you for being here.
Totally.
Okay.
And nothing from Andrew's side.
I've done so much. I wanted to make sure that everyone had a voice. It was funny actually, because a couple of the companies that I've seen today, I have actually seen. Although I should stress, I was not a judge at the time. I was actually doing the job that Valentine has done a great job today on, by the way. So thank you very much, Valentine. I know it's very challenging being that person to go, right, that's enough. So I've been on that side before. But honestly, I just reinforce everything you said. I mean, Marcel, I think you nailed it. The diversity of what we saw today always makes being a judge even more challenging. And also the bravery, I think the courage that you have to display to get up there and put yourself out there. Doesn't matter whether it's, 50 people or 5,000 people, putting yourself out there, putting your company out there to be ultimately judged by other people is always a challenging thing. So thank you so much to all of you for the effort, the energy, and what you brought today. And I think there's been some really, really good feedback. And yeah, I'm just well done to all of you. It's been great.
Okay, and we are ready to announce the winner. Okay, I was actually looking, to be honest, for some music on YouTube, but you did assist me with that, Andrew. I'm going to share my screen, and and in a second, I'm going to slide, and we'll see who the winner is. But a little bit more attention, right? Judges, are you ready? Startups, are you ready?
Yeah.
First of all, are you still here? Let's see on the chat. Startups, are you still here? Please write a yes. I want to see 20-something yeses on the chat, unless. Okay, so the winner of today's speech event, DMS Investors Day, is Advanced Infrastructure. Congratulations.
That's amazing. And look, I mean, although it seems like we did it in record time when we went away, it was not an easy decision. As we've already said, it was a fantastic competition across many, many different areas. I think if we were to look at advanced infrastructure, there were a couple of things that really stood out with regards to where they're at. What they've already achieved was part of it, but the problem that they're solving for as well. I think certainly from my perspective, one of the things that I was really impressed with was the diversity of backgrounds within the team and really how they're bringing that together to create obviously a very high performing unit. And I think ultimately one of the things that came through was how we actually saw this adding value to so many different industries rather than just being aligned with one particular area, and how it could be genuinely transformational. So it was an amazing job. We also actually did want to just emphasize there was one other startup that we wanted to give a special mention to, which was Arete. We think that as a concept, it was a fantastic solution that's being developed. But we really thought, Christopher, well done. Congratulations indeed on being successful today.
Thank you very much, guys. It does mean a lot to us and our team, and they're super here. They're super happy to hear this as well.
Oh, I just realized I was trying to put myself on mute to give you a chance to talk. I was expecting a long speech, Christopher, today, and to call all of the members of your team out and how it would. Please tell us more.
Please make us cry.
Well, I mean, this is not the result of just one practice session. We've been pitching a lot. A big thank you to the DMS team, especially our mentor Dennis, who's helped us in many ways, not just pitching but proposition development and linking us in with other accelerators. I just really want to thank him first, but he does know how good he is anyway, so that's fine. And
just hearing himself on Slack, don't worry.
Just speaking for the rest of my team, thanks very much. And this stuff really does help. I think what we win, it's not money, it's access to HubSpot and stuff. And our chief marketing officer knows that we need that, and it really does help with all the go-to-market stuff. So it's going to be put to immediate use. So big thank you for that.
Fantastic. That's brilliant, Christopher. Well done. I know that we were all really impressed. Both, I mean, to be honest, it was a very polished presentation, very nicely delivered, but it was also the information that I think that was in there that really stood out. I think, Michael, you called out something specifically yourself, didn't you?
well, obviously working for Deutsche Bahn, this is one of the highest energy consumption company in Europe, or Germany at least. So I can really relate to this topic, and I think it's getting bigger. And I like the banana example, putting a green label on a yellow banana or on a black banana, whatever. This is definitely a huge case, I think. Yeah.
So there you go, Christopher. We're even helping you develop some business.
Yeah, we helped with the banana. Yeah, we thought the banana was quite risky, but we thought that after like an afternoon of pitching, you need something to remember us by, and we knew that it would be the banana. So so that was a good decision. Thank you, guys.
The secret sauce.
Awesome. Well, on behalf of the team behind DMS, I do have to thank all my colleagues. There are a lot of them. We've been working for a few weeks. I can barely take any credit for that. There's Rob, who's the project manager, he did an amazing job. There's Adam, who provided the technical, Dennis, and everybody else, Laura, Maria, Joa, Aaron, everybody. I want to thank them for everything. Hopefully, the startups enjoyed the road so far, and we still got some milestones to achieve. Jury members, thank you very much for your participation. We got the prizes we're going to share with the startups. We haven't forgotten about that, and we'll continue to work to take everyone to the next level. And until next time we'll meet, let's stay connecting online. We'll be delivering one-on-ones, okay, because this is what we have promised. So investors one-on-ones, networking, and everything that we'll be able to provide. Don't hesitate to reach us. Okay, there's the email. Rob, please write on the chat the email that people can contact us at, in case there are other participants. And because it's very late and we've worked very hard. It's not wine, it's water, but cheers to everyone. Thank you very much.
Cheers.
Cheers.
Thanks a lot, everyone.
Thank you. Bye-bye.
Bye-bye. Ciao.
Bye-bye.
Very much. Bye.